Hi, I'm Yolanda Pham. I'm an MD and PhD student at Loyola Street School of Medicine in Chicago, and my presentation is on trends and perceptions of gun violence injuries in Chicago and national media. And this project was done in collaboration with the Department of Public Health Sciences and Emergency Medicine at Loyola. This project was started through the Collaborative Gun Violence Committee at Loyola, as well as what we heard at a local community safety summit. And so, as we probably all have heard, gun violence injuries have been increasing nationally and in the Chicago area. And exposure to gun violence in the community can increase risks of individuals' own victimization and lead to poorer overall health. So media coverage surrounding this incidents can often shape how communities view the problem and potentially actually affect local violence that's occurring. So the objectives of the study were to investigate actual injury trends and compare it to trends in web interests of gun violence to explore discrepancies between community level perceptions and actual trends. And we also wanted to use this to inform future interventions for decreasing gun violence in the community. So we looked at data from our hospital, which is a level 1 trauma center in the west suburbs of Chicago, and we examined cases associated with gun violence injury from 2007 to 2017, looking at cases, mortality, injury severity, and at mid-quarter and year. And we did our analyses using Stata to analyze these trends across the quarters and years. We then examined Google Trends data, where we looked at different search terms related to gun violence to indicate people's web interest in looking up gun violence, including in the US, Chicago, and in the top 5 cities with the highest violent crime rates. We then did some exploratory analyses to examine the peaks and trends and comparing them across search terms and regions. And we then compared this data with our data on injury trends to explore discrepancies and figure out how we can address them in the community. So figure 1 here shows that there's been an increasing trend in gunshot wound frequency seen at the hospital. And figure 2 shows that these cases were often occurring more often in the hotter summer months, which is what we expect in a place like Chicago. We also found that about 10% of the cases were deceased at discharge, and over time, throughout this 10-year period, the fatality rate and injury severity didn't significantly vary over time. So these figures show the Google Trends data for searchers within the US for gun violence as well as Chicago gun violence. And this data is all relative to the highest peak that is seen in the individual graph. So as you can see, both of these terms were searched at a relatively stable rate until around 2012, where after this time you can see some peaks indicating increased interest in gun violence searches at these specific time points. But if you compare these two figures, you can see that there are more peaks in this bottom graph compared to the one above, which indicates that people seem to have a greater focused interest in Chicago gun violence compared to gun violence in general. Similar trends to those previous figures were also observed for the search terms of shootings compared to Chicago shootings, and similar trends were also observed among Chicago searchers compared to those US searchers in the previous figures. When we looked at searches for shootings in the top 5 most violent cities, we saw that there was a relatively lower increasing trend, showing that people seem to have a greater interest in Chicago versus these cities with even higher crime rates. So overall, we saw that gun violence and web searches have both been increasing over time, and people seem to have a greater interest in Chicago violence compared to overall violence, as well as in cities that had higher crime rates. And so this kind of shows how media can affect people's perceptions of gun violence that occurs in specific locations and lead to some potential misconceptions about the trends and injuries that are actually occurring. And this can really affect an individual's own perception of the violence occurring in their own communities and affect how they form social networks and interact with their neighbors and fellow community members. So future studies plan to look at social media data such as Facebook and Twitter to examine these trends, and we're also planning to present this data to local community organizations to see what we can do together to address these perceptions and create some solutions towards decreasing overall violence. So thank you very much for listening to my presentation. I'd also like to thank my collaborators for all their help and support with this project. And feel free to reach out if you have any questions via my email here. Thank you again, and stay safe.